Alright, this is for the second case study. So for my role, I am playing a gynecologist, and that is the focus practice on women and their reproductive organs. They're also commonly known as an obstetrician gynecologist. My practice is a free clinic that women can come to in their time of need. This clinic also specializes in ovarian cancer. So ovarian cancer is mainly affects elderly women, and especially women that have not given birth. They're the most at risk. We see about 1,500 patients a day, and unfortunately, about 77% of those women that come through the clinic are diagnosed with the advanced stage of ovarian cancer. The main symptoms are bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, and urinary urgency or frequency. Usual treatments of ovarian cancer can be found in 4 different stages. So the treatment plan, it varies depending on what stage you find it in. Sorry. The most common types of treatment for all stages include surgery, chemotherapy, hormone therapy, targeted therapy, and radiation therapy. And typically, the treatment plan will include 2 or more of these therapies. Depending on what stage of cancer the patient's diagnosed with, that will depend on how long the treatment will need for each patient. One particular patient from my clinic is an 84-year-old Caucasian female with a middle-class wage who came into the clinic with no pre-existing health conditions. She complained of abdominal discomfort, trouble eating, and frequent urination. I performed a hysterectomy, a bilateral salpingogra- salpin salpinography, a bilateral salpingoophorectomy and an omentectomy. Oh my goodness. There's evidence of metastatic involvement of the omentum and diaphragmatic metastasis that concluded in stage 3 epithelial ovarian cancer. A pap smear is not performed because it would not detect the presence of ovarian cancer. The patient, following the surgery and chemotherapy, the patient's cancer antigen CA-125 levels declined to 7.3 units per milliliter. The patient's abdominal distension and pain and the sense of fullness subsequent to eating were alleviated, while the urination frequency was reduced. But that did not last very long. Her pelvic CT scans showed post-operative agenesis of the uterus and ovaries, as well as soft tissue shadows at their junction between the rectum and sigmoid colon and in front of the intestine. A gradual improvement was observed in the patient's condition. Dyspnea, abdominal distension, and abdominal pain were significantly reduced. The patient had a significant improvement in appetite and urine, and feces had returned to normal. My recommendation for prevention of ovarian cancer is to begin taking oral contraceptives as early as you can. It reduces the risk. And also, breastfeeding and pregnancy will decrease a woman's risk, especially if they have children before 25. And then surgical prevention is also a main one. And it helps with prevention, especially with women with high risk of ovarian cancer or if it is already diagnosed. There are a variety of procedures like tubal ligation, a hysterectomy, and an oophorectomy that can decrease your risk. And with every surgery comes their own risk. So every patient in my clinic would get informed on every single procedure, risk, and advantage. So before they say yes, they can know all the ins and outs. Major problems that still need to be addressed so that women can be aware of this, and so that women can be aware if they have ovarian cancer or not, is they need to be educated on the symptoms, and education about cancer can be the main preventative, and they should also always go see their gynecologist as early as possible.